Good.
Hello, my name is Nick Fisher, and today I'll be going over the job of a registered nurse. The career of a registered nurse, or RN, is one of the many careers growing in the U.S. With the aging population increasing and the number of people willing and able to provide specified care, this is why, to this day and age, that nursing has become such a growing profession. The everyday work tasks and activities of an RN vary depending on what setting one chooses to be in. The different settings of an RN include general and surgical hospitals, doctors' offices, nursing care facilities, outpatient facilities, and home health care services. In a general and surgical hospital setting, the everyday work tasks and activities an RN may encounter are providing surgical patient care, planning and implementing the nursing care patients receive before, during, and after surgery, patient assessment, and creating and maintaining a sterile and safe surgical environment. Some other things that a RN would encounter in a general and surgical environment would be pre- and post-operative patient education, monitoring the patient's physical and emotional well-being, integrating and coordinating patient care throughout the surgical care continuum. In a doctor's office setting, an RN would typically undergo checking the patient's vitals and medical history, assess the patient as a whole, administer vaccinations, and assist the doctor or physician with any care assessments if need be. In a nursing home setting, RNs will mainly deal with ensuring that the proper care of the residents is being done and that the needs of all the residents are met. This means RNs in this job description will make sure patients maintain acceptable levels of personal hygiene, have clean beds and receive proper nutrition, monitor vital signs, give IVs, and administer medication and draw blood. Outpatient facilities involve RNs in everyday work tasks and activities by using them to evaluate patients and organizing plans before implementing them and providing nursing care. RNs in this setting determine the appropriate equipment and medication that will be needed for care. They perform care related to licensed practice. They also assist physicians and or doctors if need be. In a home health care service setting, an RN will typically go through everyday work tasks and activities in an individual's home. Typically, a home health care RN will care for an individual who is chronically ill, disabled, or suffering from cognitive impairments. Some other things that an in-home care RN would encounter are helping dress or bathe the individual, ensure that the individual's needs are met, administer medication, monitor vital signs, and educate patients on healthcare. In order to become a registered nurse, there are education requirements that need to be completed before anything. The first step is graduating from high school. A high school education is an essential prerequisite to becoming a registered nurse. The second step is completing a nursing degree program. Diploma programs are offered by hospitals and generally last 3 years. They feature the least intensive course load and can delay advancement in the field compared to degree holders. One can also obtain an associate's degree in nursing. An associate's degree takes 2 years to complete and are offered at many community colleges. These programs prepare an individual for entry-level nursing positions at hospitals, adult care facilities, nursing homes, and other health-related establishments. The third and final step is becoming licensed. All states require registered nurses to pass the National Council Register examination. This examination is administered by the National Council of State Boards of Nursing. This comprehensive 6-hour test assesses an individual's understanding of care management, health promotion skills, psychosocial and psychological integrity, preventative treatment abilities, basic care, and several other permanent topics. The other requirements regarding licensure vary by other states. When it comes to working conditions, it all depends on which type of practice you enlist in as an RN. Some jobs are a more relaxed setting, like home health care and doctor's offices. whereas in a nursing home or a general/surgical hospital setting, it is a faster pace and more anything can happen type of atmosphere. There are different paths that you can take in the nursing profession. What's great about this career is that you have the opportunity as an RN to choose a particular practice that interests you the most. These areas of interest that you can be in are defined as specialties, which mean you are a certified and registered nurse with a specialty in whatever path you choose. Some specialty categories of an RN include pediatrics, gerontology, cardiology, neuroscience, orthopedics, plastic surgery, and radiology. When it comes to this profession, you can never be too prepared. With the continued advancement in healthcare, new and more efficient ways to care for an individual are being discovered. Some ways to be sure that you are prepared for this profession is to get involved in the aspect of your future nursing profession that you would plan to be doing for that career. For instance, if you plan to be a nurse with a specialty in gerontology, it would be in your best interest to experience what caring for the elderly is like. A way you could do this is by getting a job as a certified nursing assistant and caring for the elderly at a nursing home. As an RN, the hiring process can vary from state to state and job preference to job preference. Depending on the demand for RNs in an area, it may not matter how experienced or what kind of nurse specialist you may be. It all depends on what is needed and what settings you prefer to work in. However, the demand in the U.S. is extremely high, so it will only be a matter of finding a location and a job that fits your job description that you're looking for. An RN is a very profitable career. Salaries, however, differ depending on the preference of where you wish to work. Depending on the setting, you can be making different ranges of income. In a general/surgical hospital, you can be making about $69,000 a year. In a doctor's office setting, you can be making about $72,000 a year. In a home health care setting, you can be making about $65,000 a year. In a nursing care facility, you can be making about $60,000 a year as well. And in an outpatient care facility, you can be making around $72,000 a year. As far as the employment rate in this particular profession, it is extremely high. All around the United States, nurses are needed. Some states in the U.S. that are particularly high include California with about 250,000 employed RNs, Texas with about 184,000 employed RNs, New York with about 176,000 employed RNs, Florida with about 164,000 employed RNs, and Pennsylvania with about 130,000 employed RNs. Some states that RNs are in need for include Alaska with only about 5,000 employed RNs, Wyoming with only about 4,000 employed RNs, Montana with only about 8,000 employed RNs, North Dakota with about 8,000 employed RNs as well, Vermont with only about 6,000 employed RNs, and Hawaii with about 10,000 employed RNs. The career of a registered nurse is one of the many growing professions in the U.S. With the world's aging population increasing and the number of nurses decreasing, the demand as well as need for RNs has become more and more apparent over the years. This job is not for everyone. However, if you are someone who strives to better an individual's life in a physical, mental, or psychological way, the career as a registered nurse is the job for you. Thank you all for listening.